have, there might be chairs next door.
No, we don't need chairs.
Got another award to give out. And this time, it's to Dr. Gray.
Oh.
So,
You're here today.
I knew they were here for you.
You did?
Yes, I did.
How'd you know that? They were here
We
one
know
other
these
time.
things.
because we were here before and you weren't. When we gave Dr. Swisher his award, we were going to give both of you. This is the Golden Heart Award. And you were nominated with a letter. And the criteria for this is on bedside manner, responding in a timely manner, compassion, and standards of behavior. And so the letter says, even as a part-time physician, Dr. Gray still manages to display all the characteristics of a Golden Heart Award winner every day. For bedside manner, Dr. Gray spends the time with each patient that they need. She makes sure she talks to each patient in a way they can understand their care options. For responds in a timely manner, Dr. Gray works every day, even though she only is scheduled for our clinic 2.5 days a week, to make sure that patients don't have to wait for a response because she isn't in the office. Dr. Gray will call patients herself and use the portal to communicate with patients to help them receive answers faster and directly from her. Her lead nurse, Susie, always feels confident in letting patients know they will hear back within a day, 2 days at the most, and never worries that time frame won't be hit. Dr. Gray is able to tell me patients' home life situations often. There are 2 recent examples of this where Dr. Gray has gone out of her way to understand the situation the patient was in and made sure they were comforted and taken care of. First was a patient who is a teenager, was coming in for a post-hospital visit with her mother, and both of them were a little nervous and unsure of what to expect and what the problem was. Dr. Gray didn't take some of the patient's frustrations personal, and instead took time to talk to the patient and help them understand what to expect. Another patient came in, and Dr. Gray took time to ask about her home life and learned the patient was homeless. She spent time to ensure that she was getting taken care of and learned that she was being supported by her church family. Both of these are just recent examples of how Dr. Gray spends time to understand the patient more than just their problems, but their whole life. She understands patients are coming in concerned and spends time to listen to them. Dr. Gray is always professional and has complete ownership of the work she does. There isn't a day that she isn't emailing or talking to me about how we can improve the care we provide at Forest Park. She has taken ownership of starting new programs for our Well Child Visit, such as Reach Out to Read, 5210, and the First 5 program. She wants to know how she can help the clinic succeed. Her lead nurse, Susie, feels comfortable approaching Dr. Gray with any questions or concerns regarding patient care throughout the day. Very nice letter.
Apologize for to come back.
It's all right.
Well, he's
Obviously from one of your staff that wrote that. So, very nice. So we have a nice plaque for you.
And you're always upgrading our clinic. We really appreciate you as a partner. Thank you.
And a pen for your pen.
The camera's a little moving.
Channel 3 News.
There you go.
Okay,
Very
you.
nice.
Yeah,
I'm just gonna copy the letter.
okay. All right, thank you.